Well, good morning. Welcome back to the Broadcast Retirement Network. I'm Jeff Snyder. This is BRN AM for Tuesday, August 22nd, 2023. And our top story today, navigating insurance denials for mental health conditions. And joining me now to discuss this and a lot more, Daniel Lloyd is with the Kennedy Forum. Daniel, great to see you. Thanks so much for joining us on the program this morning.
No, it's my pleasure. Thank you for having me, Jeff.
Let's talk about mental health. And this is a huge issue. I think mental health has always been a big issue, but it's become so pervasive during and post-pandemic. I want to start off, how big is this issue about people managing their mental health? And does it have a specific age, gender? Does it fall in a specific age or gender?
Yeah, mental health, affects all of us. We all have mental health and, all have mental health needs. But certainly, many people struggle, and many of those struggles got worse, during the pandemic and in its aftermath. And also, there are many people who have mental health conditions and substance use disorders, which really need can benefit from treatment. So it's there are estimates that these illnesses affect 1 in 5 Americans at any point in time. But tragically, many people don't get the help they need. So for people who with substance misuse challenges, only about 10% get the help they need. So these conditions affect all ages, including older adults. I think there's often a presumption that these are kind of younger people's illnesses, and certainly they often present early on in life. But everyone anyone can have mental health challenges, and it's important to be able to access services and to get help and get support when you're struggling. So definitely all ages and everyone is affected, all groups are affected. But certainly the pandemic has had a broad effect across all ages. But particularly older adults obviously suffered tremendously during the pandemic.
Yeah, really good point. And at different points in your life, you're going to have different challenges. How you overcome that, you need therapy, you need assistance. Sometimes it's hard to do things alone. Now, we do have a mental health hotline here in the United States. How effective has that been in terms of mitigating some of these challenges? I mean, has it been effective, or are you still? I mean, from what I've read, there've been call volumes have been higher, but in terms of treatment, how's that helped at all?
Yeah, so it's an important development over the last couple of years. Congress created, there's been a suicide prevention hotline for a long time that was, a 10-digit number, 10-digit toll-free number, which was honestly hard for people to remember, a 10-digit number. So just a couple of years ago, Congress, created, passed legislation to create a 3-digit number, which is 988. Much like 911, 988 is meant to respond, to mental health and substance use crises. So someone could be having suicidal thoughts, or someone could just be struggling. You can call 988 and have someone who's trained talk to you and offer assistance over the phone. Now, many problems can be taken care of over the phone, but not all problems. Sometimes people need an in-person response. And so many states across the country are really building up systems to respond in person if the person, if the individual needs it, with trained clinicians who can help, if someone is having a mental health crisis. And then, the third piece that surrounds this new 3-digit hotline 988 is not all problems can be taken care of just in through that in-person response through what's often called a mobile crisis response team. Sometimes people need treatment through crisis stabilization center, so an actual place that they can go. So we're trying to build up this system, but 988 is really the center of it, much like 911 is the center of our physical health response system. And the 988 number went live just over a year ago, and the response has really been tremendous, both highlighting the increased need, but also that people can remember a 3-digit number much more readily than they can remember a 10-digit number. So there have been many millions of calls over the past year, and it's helping people get the assistance they need, both over the phone and increasingly in person. And if they need to go somewhere, offering in-person treatment as well, when that's necessary. Although the vast majority of calls to 988 can be resolved simply by talking with someone over the phone.
Yeah, I mean, it certainly helps to talk to someone, but David, talking to somebody in person, it's like doing a transaction. It's like going shopping. It's hard to buy clothes over the internet. It's hard to buy clothes over the phone. It's really good to get in front of somebody who can look at you, measure you, engage you. Let's talk a little bit about mental health and insurance, health insurance. A lot of Americans have health insurance through their employer, or they may go through the Affordable Care Act, the exchanges that exist. Does insurance cover in general? Because I know there's always exceptions to the rule, but does health insurance generally cover mental health visits like we're talking about? I need to go see someone to talk through an issue maybe 10 times, 15 times to help resolve an issue. So does health insurance help pick up that cost?
Yes, health insurance coverage has improved, significantly over the years. And one of the areas that I work a lot on is something called the Mental Health Parity and Addiction Equity Act, which for many types of health insurance requires that coverage be equal with physical health coverage. So the idea is that the brain is no different from the rest of the body, and that mental health conditions should be treated just like physical health conditions. And you mentioned many Americans get their health insurance through their employers or through the Affordable Care Act, individual marketplace. Both of those are subject to parity protections. So in general, individuals should not be seeing restrictions on coverage for mental health and substance use disorders. Now that said, the law hasn't always been implemented in a way and enforced in a way that is really necessary. So there are efforts right now federally by the Biden administration to strengthen the existing rules to make sure that people can actually access care when they need it in health plans that are subject to the Federal Parity Act rules. Now, one major gap that actually affects older adults is in Medicare. In Medicare's coverage for mental health and substance use disorders, while it does cover many services, there are some gaps in what Medicare covers that Congress needs to actually close those gaps. And because older adults should not be should be able to get the same care that everyone else gets. So there's some work that needs to be done there, to close some of the gaps within Medicare, including making sure that the parity rules apply. Because right now those parity rules don't apply to Medicare, which is a significant gap that Congress needs to fix, and there's some efforts underway to do that.
Yeah, and David, I want to take a very quick break. When we come back, I want to talk about how do you overcome if you get a rejection or denial, how to find access to these benefits. You're going to want to stay tuned right here on BRN AM. Imagine a new television network that will make you richer, healthier, and in control of your financial future. This network is for the policewoman in Nashville, Tennessee, the baker in Dubuque, Iowa, the teacher in Lexington, Kentucky. We want to make the idea of savings and retirement culturally relevant. But what do you see as a defining issue of the midterms? Especially for the smaller businesses. I mean, they are the lifeblood of the American economy. Featuring exclusive interviews, current affairs, and docuseries. 33 years old, you retired early.
The philosophy is money only matters if it helps you live a life that you love.
But you got to start thinking about retirement as soon as you get in.
The Broadcast Retirement Network will drive very high engagement with premium partnerships. So this isn't retirement and savings for your parents or grandparents. This is for all Americans. And we're going to change the way you think about money. Welcome to the next frontier of retirement and savings. This is BRN, the Broadcast Retirement Network. Well, David, thanks so much for staying with us. Really appreciate you hanging around for segment number 2 this morning.
No, thank you, Jeff. I really appreciate the conversation so far.
Yeah, this is a really... All right, David, let's talk a little bit about how to get access to some of these insurance benefits. And, you know, states regulate insurance, but there is a federal law that kind of protects these benefits. How do I find out what health benefits are available to me, and how do I access them?
Well, for older adults, over 65, they're automatically eligible for participate in Medicare, either through traditional Medicare or Medicare, Advantage plans. So that's probably the easiest population to know, what they're enrolled in. For other populations, including people younger than 65, many are enrolled in employer-sponsored plans. Others are, get their health insurance through the marketplace, and yet others, get insurance through state Medicaid programs. So there's a mix, and kind of who enforces what rules. It's honestly a bit complicated. Although for Medicare, that's a federal program, and so it's only the federal government.
So would I look at my summary plan description or my plan highlights for my particular plan to see, some plans may grant you 5 sessions, 10 sessions. They may pay a portion up to a certain deductible. What's the best place for someone watching this, maybe who wants to go see a therapist or, get treatment from somebody? Do you check with your employer human resources department? What's the way to find out about this? Because more employers are really focused on this mental health because it does have an impact on your productivity at work.
No, it certainly does, and that workplace mental health is really important to productivity and the strength of our overall economy. Where people can go to find their plan policy, it's often called. Sometimes it's called a certificate of insurance. Sometimes it's summary plan description, but it's often the place to go is the plan website. So you'll often have a login for your plan website, and it can be found there. You can also ask your HR department, or you can even call the number on the back of your insurance card. But knowing what is covered, is critical if you're going to seek services, because you don't want a surprise where you think something is covered and in fact it's not. So it's really important to look at these documents to ensure that what the types of treatment that you're seeking or types of care that you're seeking, that to know what the rules are, and look at your health insurance policy, which is really a contract of what the health insurance plan, what they have to provide you, given your needs.
Yeah, sorry, I didn't mean to interrupt you. I was going to you probably also want to check with your practitioner. So say you pick therapist A and B, you want to make sure that they take the insurance. And a lot of times they can kind of coordinate. They often have a advocate within the organization to advocate on behalf of finding out the payments. David, what happens if I'm denied coverage? Let's just say that I want to go to a therapist. I have some type of issue. I want to talk about it. And let's just say that the insurance company just denies that and says no. I mean, what do I do?
Yep. Well, you should first try to understand the reason for the denial. They're required to give you, why they've denied the services. If they've been denied because the health plan, says that it's not medically necessary, given your condition, then it's important to talk to your provider and really try to get your provider's help to justify why it is in fact important for you to get these services. Then so your provider can be very helpful in making that case. It's really important that people challenge denials that they don't believe are correct, and file appeals both internally with their health plan, and then if they continue to be denied, file an external appeal, because many people don't actually appeal denials, and simply take the denial as a given, that care is not going to be reimbursed. When in fact, oftentimes, somewhere half or more of appeals are successful. So you have a pretty good shot, particularly if you understand what your plan policy says, and then enlist your provider to help you. And if you need other assistance, there are advocacy organizations who you can sometimes call. Some states have mental health ombuds offices, which can actually help. So try and get some help. Definitely list your provider, but don't be afraid to appeal denials, because you often can get the care covered that you need.
Yeah, I like that you bring it up, that it's a contract. It is a contract. The provider is supposed to provide you the services that you both agreed upon. So, and you should advocate for yourself. I mean, no one's going to do more than yourself to get you the help you need. Well, David, we're going to have to leave it there. There's a lot to uncover, and I want to bring you back again on the program. We can talk about what we can do for our folks who are under Medicare. David, great to see you. Thanks so much for joining us, and we look forward to having you back on the program again very soon.
My pleasure, Jeff. Thank you so much.
And that wraps up this episode of BRN AM. Have a topic of interest, someone you think we should talk to? Drop us a line. And don't forget, for all the latest curated news and lifestyle, wellness, finance, tech, so much more, all in one place, check out today's edition of our daily newsletter, The Morning Pulse. Want to search our archives, check out our latest content? Well, then visit our website. We're back again tomorrow for another great edition of BRN AM. Until then, I'm Jeff Snyder. Stay safe. Keep on saving. And don't forget, roll with the changes.
But if you're tired of the same
Now is your opportunity to co-create content around any topic on the First Lifestyle and Wellness Network. Reach a global audience through our platform and co-own exclusive branded content. All of our programs are available on demand and also as audio-only podcasts, so you can take us on the go. Broadcast Retirement Network, available anytime, anywhere, and on any device.